Next, let's talk about segment 8, miscellaneous test for various conditions and causes. To ensure that we have covered all bases, let's go over some additional tests that might be relevant for specific causes of chronic constipation. And these tests can help diagnose rare and less common causes that may be contributed to chronic constipation. Let's dive in. So here we are going to talk about 7 tests, and we are going to continue our serial number order from our previous segments as well. So number 37 test is blood test for Trypanosoma cruzi antibodies. 38, genetic testing. 39, specific allergen test and elimination diet. 40, serum markers and endoscopy bioscopy. 41, autoantibody test and clinical examination. 42, sweat chloride test and genetic testing. And 43, anorectal examination and imaging studies. Let's talk about blood test for Trypanosoma cruzi antibodies. You may want to consider the test if you have traveled or lived in areas where Chagas disease is prevalent. The purpose of this test is to diagnose Chagas disease detecting these specific antibodies. Because Chagas disease, which is caused by parasite Trypanosoma cruzi, can lead to chronic digestive symptoms, including chronic constipation. And a blood test to detect antibodies against Trypanosoma cruzi is done. So blood is simply drawn, and the presence of antibodies will indicate exposure to Trypanosoma cruzi. And normal result is no antibodies detected, and obviously it has minimum discomfort. And if Chagas disease is confirmed, antiparasitic treatment and monitoring for complications may be recommended. So this is one more additional test you can done if other conditions are ruled out. Let's talk about next testing, which is genetic testing. And genetic testing can be crucial for diagnosing hereditary conditions that might affect the bowel conditions or functions. The purpose of this genetic testing is to identify familial dysautonomia through genetic mutations. Because familial dysautonomia is a genetic disorder that affects the autonomic nervous system, leading to various symptoms, including chronic constipation. For this, a blood test or a saliva sample is taken to analyze DNA for specific genetic mutations. The presence of mutations indicates familial dysautonomia, and normal result would be no genetic mutations detected. Obviously, very minimal discomfort because only blood is drawn, and if genetic mutations are identified, genetic counseling and specific treatments for symptoms may be recommended. Next, number 39 is specific allergen test and elimination diet. And if you suspect a food allergy that might be contributing to your constipation, this approach can be very useful. The purpose is to diagnose cow milk protein allergy by identifying positive allergen test and symptoms involved improvement on elimination. Because food allergies such as cow milk protein allergy can cause gastrointestinal symptoms, including constipation. For this, blood test or skin prick test to identify specific allergens, followed by an elimination diet to confirm the diagnosis. So for this, no specific preparation is required. The procedure involves A, blood test, B, skin prick test, and third, elimination diet. For blood test, a blood sample is taken and analyzed for specific allergens. For skin prick test, a small amount of allergen is applied to the skin to observe reactions. And for the elimination diet, the suspected allergen is removed from the diet for a period of time to see if the symptoms improve. And the analysis is positive allergen test and symptom improvement on elimination confirm the diagnosis. And obviously, the normal result is no allergic reaction or symptom change with elimination. And obviously, there is mild discomfort from skin pricks or blood draw or elimination diet can be quite challenging. Uh, and after this is done, maybe reintroduction of the allergen to confirm the diagnosis and dietary modifications may be recommended. Next, let's talk about serum markers and endoscopic bioscopy. We have also talked about these things in detail above. Here we are talking about this again because for more complex inflammatory conditions, these tests are vital. The purpose of this test is to detect inflammatory bowel disease through elevated inflammatory markers and inflammation on biopsy. Because IBD, including Crohn's disease and ulcerative colitis, can cause chronic gastrointestinal disorders, including chronic constipation. And blood tests to measure inflammatory biomarkers and endoscopy procedures to obtain tissue biopsies. For this, fasting and bowel prep may be required for colonoscopy and endoscopy. For procedure involves blood test and endoscopy. We're talking about in endoscopy with colonoscopy and the upper GI tract endoscopy. So blood tests involve drawing a blood sample to measure markers like C protein, CRP, and erythrocyte sedimentation rate. Both of these are diagnostic biomarker. We talk about in a chapter on the role of biomarkers in detecting uh, different gastrointestinal conditions and personalizing the treatment plan based on those directions. We also talk about 7 different biomarkers. Uh, and on endoscopy involves inserting a flexible tube with a camera into a GI tract to obtain tissue samples. We talk about that in colonoscopy. So now, if the elevated markers of CRP and ESR are found, then the diagnosis for IBD can be done. And obviously, inflammation on biopsies can also indicate IBD. And obviously, the normal results that we are looking for is normal inflammatory markers and no inflammations on biopsy. This has a discomfort because colonoscopy requires preparation, even upper GI tract endoscopy requires preparation, and blood draw is mild discomfort. And that's confirmed. It can be followed by further imaging tests such as CT scan, and there will be a treatment management if this is diagnosis is done. For obviously, we need to confirm it, and for this test, IBD, Crohn's disease, or ulcerative colitis, this endoscopic and biopsy test are important. Next, let's talk about number 41, antibody test and clinical examinations. We also talked about autoimmune conditions earlier, but we are going to re-talk about this because this is very important. So autoimmune conditions can also impact gastrointestinal health. You already know that. And these tests can help to diagnose them. We also mentioned about Scleroderma test through positive antibodies and clinical signs. So scleroderma can cause fibrosis and this motility in the gastrointestinal tract leading to chronic constipation. So blood tests to detect specific antibodies and thorough clinical examinations can help to diagnose this. Obviously, for the procedure, no preparation is required and two-step procedure. One is a blood sample is taken to test antibodies like anti-centromere and anti-SCL70. And second is a clinical examination to assess the physical signs of scleroderma. And positive antibodies and clinical signs confirm the diagnosis. So next talk about number 42nd, sweat chloride test and genetic testing. So certain genetic conditions can have gastrointestinal manifestations, and these tests can help diagnose them. So purpose is to diagnose cystic fibrosis by identifying elevated sweat chloride and genetic mutations. Cystic fibrosis detects the exocrine glands, leading to thick mucus production that can cause gastrointestinal blockages and constipation. So a sweat chloride test to measure salt levels in sweat and genetic testing for cystic fibrosis mutations. So no preparation is required. And for a sweat chloride test, a small electrode is used to stimulate sweat production on the skin, and which is then collected and analyzed. For genetic testing, a blood sample or saliva sample is collected for DNA analysis, and elevated sweat chloride levels and specific genetic mutations indicate cystic fibrosis. And if there is normal sweat chloride levels and no genetic mutations, then we can rule out cystic fibrosis that's causing gastrointestinal disorder. So obviously there is minimal discomfort from sweat test and blood draw or saliva collections. And if this is confirmed, the further test and treatment specific to cystic fibrosis may be recommended by your doctors. Now let's talk about the final 43rd, anorectal examinations and imaging studies for structural disorders. We talked about in structural assessment section. Then finally, this is one of the another reasons why we may have chronic constipation. So we are going to conclude this with talking about anorectal examination and imaging studies. Anorectal examinations and imaging studies are essential for diagnosing structural abnormalities that can cause constipation. So purpose is to diagnose anal stenosis or atresia, anteriorly displaced anus, imperforate anus, thrombosed hemorrhoids, intestinal strictures, obstructing tumors, and anal stricture through physical and imaging assessments. Because structural abnormalities in the anorectal area can lead to chronic constipation and other gastrointestinal symptoms. For this, a physical examination and various imaging techniques such as X-rays, MRIs, or CT scans can be conducted. For this, the specific preparation depending on the type of imaging study is required. So two-step procedure. One, physical examinations involves digital rectal exams to check for the abnormalities. And second, imaging studies may include X-rays, MRIs, or CT scans to visualize the anorectal structures. And when analysis is done, it identifies the structural abnormalities that may be causing chronic constipation. And in normal anorectal anatomy with no structural abnormalities is desired, and that will rule out this structural issues causing chronic constipation. And obviously, if this is confirmed, then further tests and treatments like surgery or other interventions may be recommended based on the findings. Obviously, the mild discomforts during the physical examination and imaging procedures. So here in this various test, we want to include cover all the grounds so that if your root cause is not identified yet, you can go through this series of tests and discuss with the doctor and get the test done so that you can precisely figure out what's the root cause for your chronic constipation.